not lacking anything. And then Romans 8:28 says, and we know that in all things God works for the good of those who love him and those who are called according to his purpose. Adversity is never comfortable, but according to the word of God, there's a blessing in adversity. And the blessing is how you handle it that determines how it works. When we think of the story of David and Goliath, if Goliath never showed up, David would be known as a shepherd boy. So sometimes adversity comes, and the product of adversity is something that, even though uncomfortable to achieve, could be your greatest moment. There's a town in Alabama called Enterprise, Alabama. And this was one of the great cotton producing towns of the South in the early 1900s. And there was an infestation of the boll weevil that came into Enterprise, Alabama, and devastated the cotton crop. And so the entire population, they were discouraged, they were depressed, their entire livelihood had been taken away. A year or two later, and it's still there in the town today, they erected a monument to the boll weevil because they said that it was the boll weevil that caused them to reinvent the industry in the area. So instead of planting cotton, which had been the staple for many, many years, they ended up planting peanuts and several other crops. And so they took that moment of severe adversity and used it as a launching pad. In the Bahamas and the world today, we face a similar moment, a moment of adversity. And I believe that we will come through this successfully. But I think the key is understanding that adversity is not necessarily an enemy. It may be your greatest opportunity. So together, I want us to be reminded today that when we experience trials and challenges, somewhere along the line, there's an opportunity waiting. So may we find that opportunity, and may the Bahamas come out of this current adversity stronger than ever before. Amen? Let's bow our heads together. Father God, we thank you for this opportunity to meet once again. Thank you for life, health, strength, and for everything that we have. We know that this is a trying and a difficult time and a time of adversity, but your word tells us that even in trials, not to be discouraged, but to rejoice and know that there is an opportunity waiting and there is a way out. And we thank you for guiding us into that way out to a brighter future. In Jesus' name, amen. Our Father, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread. Forgive us our trespasses, as we forgive those who trespass against us. Lead us not into temptation, but deliver us from evil. For thine is the kingdom, power, and the glory, forever and ever. Amen.
Good morning, honorable members. Honorable members, when the business of this House suspended, the floor was reserved for the honorable member for Bamboo Town. The chair recognizes the honorable member for Bamboo Town. The chair recognizes the honorable member for Kalani.
Thank you, Mr. Speaker. Mr. Speaker, I was not physically present yesterday, but I listened to the debate. and the member for Cat Island, Ramkey, and San Salvador leading opposition had accused me of betraying my country. And he said that I had discussed and informed standards and forward as to when the election would be held. Mr. Speaker, that is an outright fabrication. The election is not due until May of next year. When that changes, the Beaming populace would know. Be they given 3 weeks notice, 4 weeks notice, 6 weeks notice, they would know. But for all intents and purposes now, the election is due May of next year. If he or Standard or Cause can get into my brain or my head, then they can determine, they would know exactly what my thinking and what was my thinking. Mr. Speaker, I want the member to withdraw that because I added no such information to Standard and Cause. I am not a betrayer. I do not double-cross anybody. Thank you, Mr. Speaker.
Thank you, Honorable Member.
Yes, yes. Where
Honorable Member, the chair undertakes to raise this issue with the member for Cat Island from San Salvador when he makes an appearance. The chair recognizes the honorable member for Bamboo Town.
Thank you, Mr. Speaker. Mr. Speaker, I rise again in this hallowed chamber to thank Almighty God, Yahweh Elohim, for affording me the opportunity to serve the people of the Commonwealth of the Bahamas, and most especially my constituents in the great constituency of Bamboo Town. Mr. Speaker, El Elyon, God Most High, who is known in the heavenlies as the Elohim of the Elohim, may he continue to scatter and confuse my adversary. Selah. Mr. Speaker, I do believe, as I have said in this place during the last budget debate, and I have said outside this place, that this administration, this Free National Movement administration, this administration of Hubert Alexander Menace, Prime Minister, has come to the kingdom for such a time as this. You know, Mr. Speaker, we remain in constant need of God's wisdom, guidance, and divine help. For we know our God is a refuge, our refuge and strength, and ever-present help in times of troubles. Indeed, Mr. Speaker, I will say, as the psalmist says in Psalms 121, I will lift up mine eyes unto the hills. From whence cometh my help?
My help comes from where?
My help cometh from the Lord, which made heaven and earth. Selah. May he continue to lift up our heads to the rising SON and continue to bless and help this Bahamas. Mr. Speaker, this psalm is reminiscent of our national anthem, in which the opening line, the opening refrain speaks of our nation lifting our heads, and in so doing, lifting our eyes and working under the guidance of God until he comes. Mr. Speaker, again, I thank the residents of Bamboo Town for affording me the opportunity to be here to serve in this hallowed, honorable, and distinguished place. Mr. Speaker, I thank them because they've allowed me to be the voice of their values and have caused respect, Mr. Speaker. I've sought to cause respect to be given to the value of their voice. Mr. Speaker, I'm going to segue here, and I see the member for Central Grand Bahama is right on cue. Let me take this opportunity to congratulate my longtime friend and colleague on his appointment as the new Minister for Youth, Sports, and Culture. Mr. Speaker, the member from Central Grand Bahama and I traveled the world together, representing and defending this nation on the battlefield of sports. The Prime Minister could not have chosen a more worthy, capable, an able person to take on the helm of the ministry after a most worthy, able, and capable individual had demitted. I want to thank the outgoing minister, whom I consider a friend, for the valiant and gallant work she did in the Ministry of Youth, Sports, and Culture. You know, Mr. Speaker, during his contribution, he mentioned the 2000 Olympics training camp in Montauban, France, the southern part of France. I remember that camp oh so well, and the challenges and triumphs of our time there. But you know, Mr. Speaker, I'm happy that during his contribution, he chose not to shed light on some of our more interesting moments overseas, like the Gold Coast of Australia that comes to mind. I'm sure he knows of what I speak. An honorable chamber. Mr. Speaker, he also chose not to shed some light on some of our angry moments, you know, with the then president of the B3As, the member for Carmichael, the deputy prime minister. I must say, Mr. Speaker, that due to the deputy prime minister's magnificent leadership of the B3As and his mentorship of both me and the member for Central Grand Bahama, it was those mentorship during those years that has molded Iram and I into the individuals you see here today, serving in the cabinet of the Bahamas, next to the Deputy Prime Minister. Mr. Speaker, let me also congratulate the member from West End and Bimini, Keisha Parker Edgecombe, on being elevated to the cabinet of the Bahamas. I know she will serve well as the Minister of State in the office of the Prime Minister. Her fantastic track record of service says just that. You know, Mr. Speaker, my other friend and colleague and family member, the member from South and Central Andros, is not here. You know, my late grandmother, Natalie Flowers, who is from South Andros, and I grew up in South Andros, was always fond of saying that those Androsians from the South, who are second, third, and fourth generations Androsians, that we're all first, second, and third cousins, Lady Pindon included, we're all family. So I say to my family from the deep South that I wish him all of God's favor and blessings. Both he and I were mentored by the late Dr. B.J. Nottage in this place. And it is interesting that both of us, during this stint of our political journey, have ended up as, Mr. Speaker, the leader of. Dr. Nottage was the leader of government business in this House during the past 5 years of the last administration, and both I and the member from South and Central Andros assumed roles that he would have mentored us in. But you know, Mr. Speaker, that decision by the member for South and Central Andros freed me somewhat. And now, Mr. Speaker, I'm unhinged by a troubled conscience. I can now go down into the South and join our family and friends and campaign without hesitation, guilt, or remorse for the F&M candidate, Kenneth Smith. Mr. Speaker, my family and I, we will be working hard to see that he is the next member for South and Central Andros. Mr. Speaker, the gloves are off, and I say this to my family in the South, my cousin, my former campaign general in Bamboo Town, Talia, who is leading up Mr. Smith's campaign in the South. I will be down there soon so we can rally the troops. You know, that's unless my good family and friend Soka, member for South and Central Andros, decides to join this great free national movement. Mr. Speaker, I stand to support the midterm budget statement and fiscal strategy report. Mr. Speaker, we have been consistent over the past 4 years as to our socio-economic strategy. The former Minister of Finance, the member for East Grand Bahama, called this current budget dispensation that we are in the most important in a generation. And Mr. Speaker, I fully agree. Why is it the most important budget in a generation? It is, Mr. Speaker, because over the past 3 years, I would say 4, this nation has faced a number of cataclysmic events of global proportion. Since Hurricane Matthew struck the major economic centers of the country in September of 2016, we have experienced nearly every natural disaster known to man in varying magnitudes. We've experienced hurricanes, Irma and Dorian. We've experienced tornadoes, storm surges likened unto tsunamis, earthquake tremors. We had to suspend cabinet because of one. Pestilence and plague, a pandemic. But we, Mr. Speaker, as a nation, have endured. Mr. Speaker, the member of East Grand Bahama in his budget communication on Wednesday, May 27, 2020, laid out for us the 5 pillars on which the fiscal year 2020-2021 budget would stand. The pillars on which we would seek to shore up and bolster our economic prospects as we move through the COVID-19 challenge. These 5 pillars were: 1, first, the protecting the health and safety of all Bahamians. 2, providing adequate social support to vulnerable members of our community. 3, stabilizing the domestic economy. 4, sustaining unemployment. And 5, accelerating government reforms. Have we done these things, Mr. Speaker? Yes, Mr. Speaker. This administration, we've done those things. We provided income replacement to the tune of some $235 million, and we are still providing. We have kept our dollar stable by borrowing in US dollars. We have kept the Bahamian people fed to the tune of millions of dollars. We have passed a number of important pieces of legislation during the course of this menacing COVID-19 pandemic. So, Mr. Speaker, with each one of those 5 bulletins, Mr. Speaker, we have been responsive, caring, and capable in regards to the Bahamian people's business. Mr. Speaker, protecting the health and safety of Bahamians was the first focus point, bulletin point, and policy of the new budget. And this was decided before the second wave of COVID-19, which started in July of 2020. Mr. Speaker, our planet has seen many plagues in recent history, but none in the modern age has met out the dire economic, social, and political effects occasioned by COVID-19. Mr. Speaker, this plague, that is COVID-19, is forever etched in the annals of global history, a circumstance for which, as the member for North Abaco said, there was no playbook, there was no manual, there was no how-to. Mr. Speaker, lest we forget, this virus tested and challenged our national response and resourcefulness. And Mr. Speaker, we have met that challenge and we have passed that test. We, the governmental leadership, the Ministry of Health, and the valiant Bahamian people, so far, we have passed that test. We did it, Mr. Speaker, because from the outset, we committed the necessary resources to combat this gruesome menace. Mr. Speaker, as this House is aware, the Ministry of Health received a total budget allocation of $21.3 million for the provision of contingency items for COVID for the 2020-21 fiscal year. Of that, Mr. Speaker, during the period from July 2020 to January 2021, Mr. Speaker, we spent $1,332,500 was spent on paying overtime to staff in the Ministry of Health. Of the 21.3 million allocated for COVID-19, 14,640,663 were expended for items and related services such as personal protective equipment for PPEs, emergency medical flights, hubcap monitoring platforms, repairs to the South Beach Health Center, ventilators, quarantine housing costs, and acute care at Doctors Hospital. Mr. Speaker, the history of how we got here with COVID-19 was such. In December 2019, an unnamed virus associated with pneumonia was reported in Wuhan, China. The year 2020 ushered in the spread from continent to continent of the novel coronavirus, nCoV, later named SARS-CoV-2, which caused the COVID-19 disease. Mr. Speaker, the COVID-19 disease was declared to be a public health emergency of international concern on the 30th of January 2020, and later recognized as a pandemic by the World Health Organization on the 11th of March 2020. The unrelenting movement of this virus resulted in the emergence of a pandemic, Mr. Speaker, of unprecedented proportions. Mr. Speaker, as it was becoming evident that this medical menace, the novel coronavirus, would not be contained in mainland China, the Ministry of Health ramped up preparedness and response activities, guided by international partners, including WHO, PAHO, CARPHA, and the CDC. There was a concerted effort to focus on 4 major areas. The first was managing the Bahamian borders. Second was effectively communicating with all stakeholders inside and outside of the country. Third was developing COVID-19 guidance policies. And fourth was preparing our health agencies to rapidly respond to the virus. Mr. Speaker, the then Minister of Health, Dr. Dwayne Sands, told the nation it was not about if the virus would present itself in country, but when. So we planned, Mr. Speaker, we prepared, and we executed by cutting the enemy off at the pass, implementing border restrictions very early on in this COVID fight. And so by the time the first case in the Bahamas was diagnosed and reported on the 15th of March 2020, and announced by the then acting Minister of Health, the Honorable Jeffrey Lloyd, we had already had a national plan for early detection and isolation firmly in place. Mr. Speaker, March 15 was the beginning of our first wave of COVID-19. Between March and July, the first wave ushered in new realities for our country, with social and economic norms challenged by health protocols and emergency measures required to break transmission of the virus. We began to talk about what was termed and is still termed the new normal. We note, Mr. Speaker, that it was exactly 1 year nearly to date that the COVID-19 menace entered our shores. And Mr. Speaker, 1 year later, we are now deploying the best and universally recommended remedy for the way forward. And that remedy is the COVID-19 vaccine that we now have in the country. Mr. Speaker, with the second wave commencing the 8th of July, we witnessed a more vicious and tenacious spread among communities and across nearly all our inhabited islands. We experienced just how difficult containment of the virus can be in a community spread environment. But again, Mr. Speaker, as in the first wave, with the leadership of the Prime Minister, we contain it. We did so We did so with the help of our team of medical professionals and experts in the Emergency Operating Center and the many healthcare workers who volunteered their service on the front line. I am advised that for healthcare workers old enough to have practice at the time, the situation was reminiscent of the early 1980s when the HIV/AIDS was first diagnosed in the Bahamas. While the modes of transmission differed, COVID-19 required the same all-in approach by the health sector. The second wave of infection clarified the point that the whole health team was required to participate in order to effectively manage the pandemic. The number of healthcare workers who volunteered and made themselves available during the first wave of the pandemic was no longer sufficient to cover the larger volumes of hospitalized patients that we saw at the time in the second wave. Hence, Mr. Speaker, the clarion call by this minister when I was appointed on July the 20th was the health sector all on board. Mr. Speaker, we were able to contain it with the use of health protocols instituted at the outset of the pandemic and reinforced in the second wave. These protocols greatly reduced the possibility of transmission of the virus, thereby limiting potential spread. To break the transmission and the chains of transmission when necessary, Mr. Speaker, curfews and lockdowns were instituted to coincide with the incubation period of the virus. Slowing spread and breaking the chains of transmission was especially essential in our family islands, which lacked the capacity to care for critically ill COVID-19 patients and to give healthcare workers a much-needed respite. Mr. Speaker, we all know the health protocols well. We know them well. I reiterate them here again for the Bahamian people because we are still not out of the woods as yet. Mr. Speaker, they are wear masks whenever we are away from home. Ensure that we maintain physical distance from anyone who does not live in our home. Wash hands frequently and thoroughly. And if soap and water are not available, we should use hand sanitizers. We are to wipe frequently used surfaces and devices. And Mr. Speaker, we must do all that we can to take good care of ourselves so that we are less susceptible to illness of any kind. Mr. Speaker, we were able to contain COVID by the use of the COVID-19 daily dashboard and the enhancement to the COVID-19 daily dashboard, which served as an indispensable communication tool for daily updates. In respect of communications, the Ministry of Health consistently produced the Ministry of Health dashboard to keep the general public informed of the number of confirmed cases of COVID-19 and other relevant health data. Information was, and still is, consistently shared about COVID-19 to ensure that all Bahamians understand the disease and the importance of isolating while sick. Mr. Speaker, we in the Ministry of Health are grateful to the Bahamas National Geographic Information System Benga Center and the University of the Bahamas for the collaboration with mapping, data analysis, and projects to characterize this pandemic. The data they generated feeds our dashboard and was a part of the information delivered during our press conferences. The dashboard and press conferences are the public's main tool to assessing our progress. Having such tool for commentary is vital. We owe the Bahamian people, Mr. Speaker, a public debt of gratitude for continually adhering to the preventative measures. It is because of their discipline that we saw low numbers for the Thanksgiving season, Christmas season, and is one of the factors as to why we are experiencing low numbers of newly confirmed cases right now. Mr. Speaker, we were able to contain COVID because in the environment of global shortage and lack of supplies of personal protective equipment, at the outset of the second wave, the Ministry of Health, through the Supplies Management Agency, was able to obtain and sustain distribution of personal protective equipment for staff working across our hospitals and private sector healthcare stakeholder agencies. These vital personal protective equipment ensured the safety and protection of our valued employees as well as our private sector healthcare stakeholders. PPE supplies and inventory distribution throughout the COVID challenge, Mr. Speaker, I can say, remains robust. Mr. Speaker, we were able to contain COVID-19 because we ensured that we were secured and we did secure additional ventilators. In respect to ventilator inventory, 74 units are functional at this time between PMH and Doctors Hospital West. An additional 28 functional ventilators are at the Health Services Center in Grand Bahama, and there are 6 at South Beach Acute Care Center and Referral Center. Mr. Speaker, AirVio high-flow oxygen delivery systems are also utilized as a part of patient treatment and management, both in Grand Bahama and here in New Providence. There are 12 of these units in GB, Grand Bahama, 2 and 2 at the South Beach Health Center. Total number provided does not include the most recent donated units which we received from the U.S. Southern Command and USAID. We proposed the following distributions for these 10 most recent donations. 3 of those units will go to Grand Bahama. 2 will remain in South Beach. 3 will be given to PMH. 1 will be delivered to Abaco, and 1 will be delivered to Exuma. Mr. Speaker, we were able to contain COVID-19 because as the amount of infected persons increased, we recognized the need for additional bed space for hospitalization and ICU management for COVID patients. So we quickly set about hastening the completion of renovations that were underway. As a result, currently, the COVID-19 bed assignment at the Princess Margaret Hospital now stands at 106, up from 33 during the start of the second wave. Mr. Speaker, we were able to achieve this through the transfer of 30 persons, boarders from PMH, to accommodation in line with their needs. We transferred some of the boarders to social services, and a few were picked up by family members. We were able to achieve it, Mr. Speaker, at PMH because the old GPC was established as a triage and holding area. Mr. Speaker, the 4-bed legacy unit was engaged for COVID-19 patients' care as well. Mr. Speaker, 30 beds were created at the special pathogens unit. 11 beds on private medical ward, which can be repurposed, Mr. Speaker, again at any time to care for COVID-19 patients. 14 beds on the medical surgical ward too. Again, that can be repurposed again for COVID-19 patients. 8 beds in the legacy unit. And thanks, Mr. Speaker, to Samaritan's Purse, we have the addition of a 28-bed COVID-19 isolation and treatment unit at PMH. Mr. Speaker, Doctors Hospital West was also engaged as a COVID-19 treatment center during the first wave. Initially, 10 beds were available. During the second wave, with renovations and augmentation, Doctors Hospital West is now able to accommodate 12 additional patients. Hence, Doctors Hospital West can now handle up to 22 critically ill COVID-19 patients. Mr. Speaker, we were able to overcome COVID because in March 2020, the Prime Minister requested that the South Beach Clinic be prepared as the South Beach COVID-19 Urgent Care and Referral Center should the Princess Margaret Hospital become overwhelmed. Consequently, teams from Inline Project Company Limited, Bahamas Welding and Fire, the Department of Public Health and Public Hospital Authority all worked together to renovate and retrofit the clinic. The South Beach Acute Care and Referral Center in September was able to treat, after renovation, 16 low to moderate COVID-19 cases. All of the potential patients can now be treated, Mr. Speaker, in the negative pressure HVAC environment at the facility, which is necessary when dealing with pathogens. Mr. Speaker, during the second wave, 2 RBDF tents, inclusive of central HVAC systems, were set up at the South Beach Acute Care and Referral Center to assist with screening and monitoring of suspected COVID-19 persons. Mr. Speaker, we were able to contain COVID-19 because we were able to get the South Beach Acute Care Center operational in a very short period of time. Mr. Speaker, as a result, I am happy to report that in the period under review, the South Beach COVID-19 Urgent Care and Referral Center cared for 3,554 patients with COVID-19. Of this amount, 67% were assessed and or triaged due to exposure to the COVID-19 virus. 5% was admitted to the facility. Of the 167 persons admitted, 71.2% were successfully managed and discharged. This spoke well of the health services provided there. 15 patients were referred to Doctors Hospital West for more intensive care. 14 were referred to the Princess Margaret Hospital. 3 were referred to Doctors Hospital East. 7 were referred to the quarantine site. And Mr. Speaker, unfortunately, 8 of our dear patients died at South Beach. Mr. Speaker, in Grand Bahama, the infectious disease COVID-19 unit added 7 additional beds for the Rand Memorial Hospital. And Mr. Speaker, 16 beds were made available through the rental of the Cancer Association building. Mr. Speaker, we were able to overcome COVID because case identification, testing, aggressive contact tracing and isolation, along with quarantining as appropriate, the proven public health measures for controlling outbreaks were used. We were able to contain COVID because we effectively deployed these measures. The COVID-19 pandemic caused a national quantum leap in our case identification, testing, aggressive contact tracing and isolation, and in our quarantining methods. Mr. Speaker, case identification is hinged to laboratory testing capacity. Mr. Speaker, we were aggressive in ensuring that the National Reference Lab was equipped with requisite reagents by the end of February 2020 to ensure in-country capacity for molecular RT-PCR testing for the novel coronavirus. We were able to do that, Mr. Speaker, and identified it months before. Mr. Speaker, this was no easy feat. With laboratories and countries much more resource succumbing to a position and not being able to detect the virus should it make it to their shores. Mr. Speaker, we did not stop there. Notwithstanding the technology and reagents availability, during the precipitous surge of cases in the second wave, the National Reference Lab became challenged in part due to human resource constraints, as may be expected. Mr. Speaker, through receiving upwards to 800 samples in 1 week at the National Reference Lab, the load on the daughter of the member for Engliston was untenable. Volunteers presented themselves to assist with data entry. Medical technologists from private sector, such as Premier Clinical Laboratory and Oak Tree Medical, offered combined processing assistance to help us bolster capacity to address the 800 sample backlog. In addition, Mr. Speaker, we hired 5 individuals at the beginning of August to help with the load in the National Reference Lab. Mr. Speaker, our testing capacity was further hampered during the second wave, in great part due to a paper-based system. We again quickly moved to address that challenge by hiring a full-time data management consultant from the University of the Bahamas. And we purchased and installed an IT platform for data collection and correlation, which was called and is called SharePoint. Mr. Speaker, we also relied on assistance from the private laboratories, from the Doctors Hospital Lab, which was able to successfully implement and validate RT-PCR testing, and was positioned to test batches of samples for us at the National Reference Lab to minimize delays and backlogs in obtaining critical results required for containing the surge. Mr. Speaker, the other private labs also joined in testing, and all of the data was collated via the Microsoft SharePoint platform. Mr. Speaker, we have since added, through the generosity of the Pan American Health Organization, 3 gene expert testing platforms, which are being used for COVID testing. 2 of the units are here in New Providence, and 1 of the units is in Grand Bahama. A further augmentation in molecular testing in the form of the Panther Fusion instrument was added to the Princess Margaret Hospital in August of last year. Mr. Speaker, our most recent addition, through the generosity of U.S. aid and the International Federation of Red Cross, is the BioFire Torch complex PCR technology, which was donated, Mr. Speaker, just 2 days ago, again, to PMH Laboratory. All of these molecular PCR testing platforms are internationally recommended and recognized as the gold standard for testing equipment. Mr. Speaker, 1 year since the diagnosis of our first case of COVID-19 our in-country laboratory capacity here in the Bahamas has mushroomed. This, indeed, is progress. Mr. Speaker, we were able to contain COVID due to the work of the surveillance unit. The National Surveillance Unit has been transformed and continues to play an undeniable, crucial role in the management of this COVID-19 outbreak. Early on, the unit generated a preparedness and response plan in collaboration with national stakeholders, which continues to be updated to inform activities of our country's context. Daily monitoring of persons under quarantine, home isolation, identified as contacts of laboratory confirmed cases of COVID, and persons recognized as cases by the newly introduced rapid antigen tests has defined the work of the unit for the almost 365 days since our first confirmed case. Mr. Speaker, a team of health professionals have been working assiduously from diagnosis of the first case to obtain the data needed to furnish the national database of cases and contacts from COVID-19. During the second acute phase of the COVID-19 pandemic, 10 senior house officers, physicians, were added to the unit, enhancing capacity surveillance as well as other key surveillance and response areas. During the second wave, due to the increase in the number of individuals needed for surveillance and contact tracing, the surveillance unit, Mr. Speaker, had to be housed at the Malia Hotel. I am pleased to announce that the unit is now housed in a building renovated, digitally outfitted, and better suited to conduct our national surveillance and contact tracing for COVID-19 and any other disease or pandemic that should present itself in country. Mr. Speaker, as COVID continues to be at the forefront of the surveillance unit, other critical disease surveillance areas, such as tuberculosis surveillance, as of necessity also continues, inclusive of monitoring persons on DOTS, DOTS, and ensure necessary contact tracing. The unit, in conjunction with PAHO, has also made progress with the implementation of the Flu ID and the FluNet in-country surveillance platforms for influenza and severe acute respiratory infection. This, Mr. Speaker, will also assist in the documentations of the different strains of the flu virus that we would have presenting in country. Mr. Speaker, we were able to contain COVID because of our enhanced contact tracing efforts. As COVID-19 evolved, the Ministry of Health retooled its approach and modality. A contact tracing strike force was activated in early August of last year, as the country began its encounter with the second wave of COVID-19. Over the course of the second wave, almost 250 volunteers assisted with contact tracing. Though some were reassigned from within the Ministry of Health, the vast majority, though, were volunteers. Specifically, 137 contact tracers from non-health sectors such as academia, the National Health Insurance, Bahamas Air, Ministry of Tourism, the Public Service, and civil society all volunteered. Although nurses on the Family Island perform contact tracing duties, their work, Mr. Speaker, was also augmented by volunteers on the islands of Grand Bahama, Eleuthera, and Exuma. Mr. Speaker, the contact tracing team additionally and early in the second wave benefited from the Hubcat electronic monitoring system, utilizing geofencing and the individual's cell phone for quarantine monitoring. We have further benefited from the efforts now. The unit now is under the remit of the member for Mount Moriah, the Minister of National Security, and we have further benefited from the efforts of the new COVID enforcement unit that was later established for enhanced monitoring of the emergency orders. Mr. Speaker, we have an increased pool of potential contact tracers for this and any future pandemic. Here I add that 220 Bahamians took the opportunity and have participated in and received certification from the Johns Hopkins online contact tracing course, which was adapted to our local context by our partners at the University of the Bahamas, and I thank UB. Mr. Speaker, to date, 8,542 cases have been contact traced. Hundreds of clusters have been identified, and close to 20,000 contacts of cases have been engaged by the contact tracers. This quantification reminds us all that contact tracing was and remains a mammoth task. In early August 2020, before a critical mass of contact tracers had been secured, the time between a positive RT-PCR test notification and the first call from our contact tracing unit was longer than desired. From then to now, the interval has been steadily decreasing, and the interval is now within the World Health Organization's limits. In fact, Mr. Speaker, from October 2020 to mid-January 2021, that interval to first call is now on average less than 48 hours. Mr. Speaker, without effective and timely contact tracing, we as a people would have always been chasing behind this COVID-19 menace. Moreover, without you, the Bahamian people's cooperation, there would be no contact tracing. It is worth repeating, Mr. Speaker, at this stage, to the Bahamian people whom I love, that evading our contact tracers, giving false telephone numbers, not sharing with our contact tracers the full extent of your movements, all of these actions hampers our ability to keep you safe and those whom you love and those who are close to you. Mr. Speaker, we were able to contain COVID-19 because we augmented healthcare worker capacity, Mr. Speaker, by hiring 29 positions, new senior House officers. 20 of those individuals, Mr. Speaker, were deployed at the Princess Margaret Hospital. 4 were deployed in the Department of Public Health. 3 are now deployed at the Sandlands Rehabilitation Center. And 2 are deployed in Grand Bahama. Mr. Speaker, of the 55 nurse candidates who sat the Nursing Council examination, 49 of those candidates passed. 33 of the nurses who were successful were sponsored by the Ministry of Health. And of that number, Mr. Speaker, 16 were assigned to the Department of Public Health and 17 were assigned to PHA. 14 of the nurses were privately sponsored. Of the privately sponsored nurses, 5 subsequently made application and was hired in the Ministry of Health. One of those hirees will be placed in the Department of Public Health, and the other 4 will be placed with PHA in Grand Bahama. Think you'd like that, Pine Ridge. Efforts to recruit 100 nurses from abroad to assist our local efforts, Mr. Speaker, at every turn proved unsuccessful, but I can get into that. Mr. Speaker, the largest single group of healthcare providers, I guess a word to the wise is sufficient, they said arts. Mr. Speaker, as the largest single group of healthcare providers, nurses played a critical role in the national response to COVID-19. They provided services in surveillance, contact tracing, hospital and community settings, both urban and rural. In some of the more remote areas of the Family Islands, nurses are the only full-time healthcare providers. During the second wave in particular, nurses were required to travel to multiple islands to provide surveillance activity and to bring relief to islands impacted by COVID-19. The nursing staff was augmented in some of the islands of the southern Bahamas and some of the other major islands. The number of nurses deployed with the school health services, Mr. Speaker, was also doubled as we sought to help the needs of our vulnerable school population group during this COVID menace. Mr. Speaker, nurse support was given to postgraduate training for nurses in emergency nursing. 5 nurses availed themselves of that at the University Hospital in Jamaica, and 18 students are in midwifery. Recognizing the importance of continued education, support for nurses in the trained clinical nursing program and grant program for the students in the Bachelor of Science degree in nursing program at the University of the Bahamas were continually encouraged. Mr. Speaker, as we move into the implementation stage of the COVID-19 vaccination plan, nurses will again have a critical role as vaccinators and will continue to provide much needed education and planning to ensure the success of the campaign. Seeing that we are still amid the pandemic, it is anticipated that the need for nurses to travel to provide relief to nursing staff in the Family Islands, as well as travel for surveillance activities, will continue. Mr. Speaker, we were able to contain the COVID-19 due to our emergency orders implemented at the border. To shore up protection at our borders during the second wave and minimize introduction of the virus into the Bahamas, early border measures were required, which required travelers to provide evidence of not having traveled to countries experiencing COVID-19 cases to border control officers. To minimize the impact of health protocol requirements on travelers while maintaining safe measures, the Travel Health Visa Portal was instituted in partnership with the Ministry of Tourism. Having now passed through multiple reiterations, the portal effectively provides a mechanism to ensure negative COVID-19 PCR test results obtained within 5 days of travel are produced for every traveler entering the Bahamas. The addition of a post-arrival testing protocol for travels with monitoring of results by the disease surveillance unit has enhanced early case identification and has served to greatly enhance our capacity to control the introduction of COVID cases to the Bahamas. Mr. Speaker, we were able to contain COVID-19 during the second wave by deploying an array of digital platforms as a part of the government's COVID mitigation strategy. These IT platforms included, Mr. Speaker, SharePoint, customization for virtual call center, and contact tracing. They include the quarantine verification solution, Hubcat. They include the Bahamas Travel Health Visa Portal. They include the workplace assessment tool. And now they will include the vaccine appointment platform, the new EIR. Mr. Speaker, we were able to contain COVID because my ministry posted the workplace guidelines during COVID-19 V9 and a COVID-19 risk and readiness tool on its website at www.bahamas.gov.bs/health for all of the businesses in country. These documents assisted employers with ensuring that their establishments are were following the COVID-19 protocols and have an environment that caters to the safety of their employees and customers. Work site visits and support from the Ministry of Health and the Department of Environmental Health teams were conducted as a part of this program. Additionally, Mr. Speaker, to help with our fight against COVID recently, the Ministry of Health, 3 weeks ago, announced the launch of the Healthy Campaign Together. Healthy Together is a government initiative to consolidate and coordinate government information, resources, and communication related to COVID, all on one website. It provides members of the public with a source of information and resource about all things COVID and how to promote and maintain health and wellness as we move into reopening responsibly here in country. Healthy Together, Mr. Speaker, is designed to be accessible and shareable by all Bahamians. The Healthy Together Bahamas website can be found, Mr. Speaker, at www.healthytogether.gov.bs. Mr. Speaker, we contain COVID because of our health team, our EOC. Mr. Speaker, I'm so proud of the health team of the Emergency Operations Center of the Ministry of Health, who met together every day and developed strategies to detect, contain, and minimize the spread of the COVID-19 virus. The Ministry of Health is also grateful for the commitment shown by the public and private sector workers, government and non-governmental agencies and partners, local government administrators, chief consulates, national security, the Ministry of Works teams, and ordinary citizens in the Family Islands. They provided support to ensure that the clinic facilities were prepared to respond to the threat of COVID-19 in our various communities. It was beautiful, Mr. Speaker, to watch how nurses, doctors, pharmacists, and clinical administrators provide relief, especially when their colleagues were impacted by the COVID-19 virus. Mr. Speaker, we say thank you to all our employees for a job well done. Mr. Speaker, the same intensity and zeal will be needed now to roll out the vaccine initiative and to continue to provide rapid antigen testing to national and visitors in the Family Islands so that we can continue to open and to grow our economy once again. Mr. Speaker, we have experienced many accomplishments in the COVID-19 pandemic response, but we can yet hasten the end of this pandemic. Getting vaccinated, Mr. Speaker, is another way that we can protect ourselves and others from the COVID-19 menace and any new potential strains. Vaccines, Mr. Speaker, have centuries-long record of saving lives. They work by preparing the body's immune system to recognize and fight off the virus. The government of Bahamas, early in the COVID-19 pandemic, recognizing the importance of assessing vaccine once available, moved forward with planning for obtaining and implementation of the vaccine. In November 2020, the Cabinet approved the plan submitted to access vaccine through the COVAX facility at a cost of almost $4 million. Since that time, the establishment of the National COVID Vaccine Consultative Committee, the NCC, has been engaged by the Honorable Prime Minister to lead the charge in support of the National Immunization Technical Working Group of the Ministry of Health. Mr. Speaker, globally there has been much progress with the COVID-19 vaccination development and rollout. In the Bahamas, the Ministry of Health serves as the regulatory authority for access and importation of vaccines at the national level. The government of the Bahamas, Mr. Speaker, will only accept COVID-19 vaccines that are pre-qualified for use by the World Health Organization and approved by stringent regulatory authorities. This is to ensure that the safety of the vaccines received are safe. This fact was reiterated, Mr. Speaker, by the Most Honorable Prime Minister this past Sunday, March 8th. To date, Mr. Speaker, 4 COVID-19 vaccines have received authorization for emergency use. They are Pfizer's BioNTech, Moderna's vaccine, AstraZeneca, Oxford, and most recently, Johnson & Johnson. Emergency use authorization provides a path to fast-track products intended for use during a public health emergency. Where vaccines have been used, there have been decreased hospitalizations, Mr. Speaker, and deaths. Mr. Speaker, more than 200 million vaccine doses have been administered since the first approval was received late December 2020. Mr. Speaker, the Bahamas has received 20,000 doses yesterday of the AstraZeneca vaccine called COVID Shield. I too would like to thank the government of India for their donation. Oh, happy day. But you know, Mr. Speaker, the good news doesn't end there. Mr. Speaker, we are scheduled to receive 33,800 doses of the initial 100,000 doses of AstraZeneca through the COVAX facility before the end of this month, March. Mr. Speaker, I intend to be at the airport again when that batch of vaccine lands as well. Mr. Speaker, the remaining 77,000 doses will be received, I am advised, before the end of the month of May. Mr. Speaker, explorations of other opportunities, direct discussions with other vaccine manufacturers are ongoing. The government of the Bahamas is currently seeking, Mr. Speaker, to purchase additional doses of AstraZeneca vaccine directly from the Serum Institute of India. Mr. Speaker, the Ministry of Health has a national vaccination deployment plan which incorporates the details for receipt of the vaccine and rollout of these vaccines. The plan covers all aspects required for an efficient rollout of the vaccine, inclusive of, but not limited to, the regulatory process for clearance of the vaccine on arrival in country. Those regulations, Mr. Speaker, if you would remember, were tabled by me in this honorable House on the 22nd of February. The plan includes vaccine cold storage and logistics. It includes prioritized groups by numbers on New Providence and Grand Bahama and total numbers required for each family island. It includes schedule of vaccinations and delivery sites with human and other resource requirements for delivery clearly outlined. It includes the vaccination monitoring and safety surveillance after inoculation program via the new electronic immunization register digital platform. Mr. Speaker, the new electronic immunization register software is expected to form the backbone of the monitoring for our COVID-19 vaccine rollout. Components, Mr. Speaker, required for monitoring of COVID-19 vaccinations are complete, and the system is installed. As the rollout gets on the way and continues, aiming at coverage of the nation's adult population, vaccine safety surveillance will be monitored by a national safety committee. Mr. Speaker, I'm informed that further details on vaccine plans will be released tomorrow by the vaccine committee in regards to the 20,000 doses of vaccines that we have received. Mr. Speaker, here's why we all need to take the vaccine. On the week of the 11th of October 2020, 743 cases of COVID were reported in a single week. This represents the peak of the second wave and is in stark contrast to the 56 cases reported in the beginning of the 21st of February 2021 compared to 2 points in time, namely the peak of the second wave and the last week's new case. Between those 2 points, Mr. Speaker, there has been a 92% reduction in the incident cases. Mr. Speaker, we need to keep these hard-won games. Mr. Speaker, we need to keep these hard-won games. Mr. Speaker, we need to take the vaccine. Mr. Speaker, here's another cause as to why we must take the vaccine. The latest national COVID-19 report reveals that on Wednesday, the 10th of March, 2021, there were 16 newly confirmed cases of COVID-19. This brought the total number of confirmed cases in the Bahamas to 8,658. Currently, there are 6 moderately ill COVID-19 patients hospitalized in the Grand Bahama healthcare system, and there are no patients currently in intensive care. In New Providence, there are 9 hospitalized COVID-19 patients at Doctors Hospital. 8 are moderately ill, and there is currently no cases in the intensive care unit here in New Providence. Okay. There are 2 moderately ill patients with COVID-19 at the Princess Margaret Hospital, and again, no patients are in ICU at PMH at this time. The total number of confirmed, Mr. Speaker, the reason why we need to take this COVID-19 vaccine, Mr. Speaker, is the total number of confirmed COVID-19 deaths now stand 185. 15 deaths, Mr. Speaker, remain under investigation. Mr. Speaker, 1 COVID-19 death to us in the Ministry of Health is one too many. We continue to pray for the families in the Bahamas who have lost loved ones to this awful pandemic. A number of our healthcare workers, Mr. Speaker, have died during the second wave. Mr. Speaker, 4 in total. They died as a result of the complications due to COVID-19. Mr. Speaker, we honor them and we honor their sacrifice. Mr. Speaker, they are Bernadette Road, a registered nurse deployed at the Sandlands Rehabilitation Center, SRC, who died on the 21st of August, 2020. They are Marion Burrows McKinney, a custodial staff deployed at the Princess Margaret Hospital, who died on the 29th of September, 2020. They are Sherlyn Charlton Bain, a trained clinical nurse deployed to Prison Health Services, who died on the 10th of October, 2020. The last individual was Jacket Johnson, registered nurse deployed at PMH, who died on the 23rd of October, 2020. Mr. Speaker, may their souls rest in peace and rise in glory. We know that Judson Ineas, I believe, had passed away, and so we mention his name as well. Mr. Speaker, I'm pleased to say that the government of the Bahamas made a commitment to the healthcare workers should they succumb in the course of their duties. I'd like to say that the cabinet of the Bahamas has approved said commitments. Again, Mr. Speaker, we thank our nurses, doctors, emergency medical services, other healthcare and essential workers for their continued dedication and devotion to caring for COVID-19 patients. We also extend our gratitude to your families who have also made the necessary sacrifice to support you in your position to graciously help others. Mr. Speaker, we have collectively achieved significant strides in the war against COVID-19, but we are not out of the woods yet. We must not let our guards down. Mr. Speaker, we need to take the vaccine. Mr. Speaker, the country is not COVID-free. But Mr. Speaker, I want you to know that there's a vaccine for you. There's a vaccine for me. And I say to the member for Exuma, your opposition is willing to stand with us, that there's a vaccine for thee. Prime Minister, he said, count him in.
I don't apologize. I don't even know when I'm getting the professional test protocol. I follow.
In the meantime, we will continue our efforts to contain the virus. Our plan in the Ministry of Health to halt the community spread is based in science and was scientifically executed. Indeed, Mr. Speaker, the response of the government has led to flattening of the COVID-19 outbreak curve in the country. The government's consistent policies continue to control the outbreak, permitting the Bahamas to enjoy a phased reopening of services and salvage some semblance of our usual way of life. Mr. Speaker, our aggressive and proactive approach, no doubt, is worthy to be emulated as the rest of the world struggles with containment and management and attempts to grapple with their escalating circumstances. Mr. Speaker, our Prime Minister, no less, was featured in the Jamaican Gleaner for demonstrating decisive leadership during the first wave of the pandemic. He was lauded for his reasoned and prudent sentiments regarding the need for our economy to reopen and the plan he presented to the nation as to its reopening in the first wave. And Mr. Speaker, just in case there was doubt, you know, they say a prophet is not respected in his own town and in his country. The second wave of COVID-19, Mr. Speaker, has brought the exact same global recognition of our efforts in the fight against COVID. Mr. Speaker, the organization endcoronavirus.org, an organization of 4,000 independent scientists assessing national response to COVID-19, lauded the Bahamas as one of 27 countries around the world that got it right in regards as to how we reduce the incidence of COVID-19 in a community spread environment. Mr. Speaker, through it all of these natural and man-made challenges we have endured, I dare say we have seen ways made out of no way. Praise to Yahweh Elohim. Mr. Speaker, we thank him for the wisdom he has bestowed on the leaders in this administration, the Prime Minister, ministers, and members of Parliament who lead their respective agencies with courage and excellence. Mr. Speaker, you too included. Mr. Speaker, we lead a chosen people whose manifest destiny is just being realized. We are a chosen generation of leaders called forth to show his excellence. Accordingly, Mr. Speaker, I stand hopeful and encouraged that in the midst of the pandemic challenges, our resolve will remain undaunting. We will mitigate our circumstances in novel and creative ways. Mr. Speaker, again, we are driven by a deep, abiding love for our people. That is why I again employ my people to take the vaccine once it is available to you. Mr. Speaker, with our approach to governing over these past 4 years, we are leading our people, Mr. Speaker, into the land of hope and promise. Mr. Speaker, with the deployment of the COVID-19 vaccine, we will cross over the proverbial Jordan once again into the land of hope and economic promise. Mr. Speaker, we will continue to stick with him, the Lord of life, as we travel this road of prosperity and challenge. We know that the road we trot, Mr. Speaker, will lead unto our God. And so, Mr. Speaker, we will march on. We will continue to march on, because in this free national movement administration, in this nation, Mr. Speaker, it is still, Mr. Speaker, the people's time. I support this resolution.
Honorable member for Bamboo Town. Honorable member for Bamboo Town. Based on the presentation of the honorable member for Freetown and your presentation, I am inclined now to consider taking the vaccine. From a patriotic perspective, as detailed by the member for Freetown yesterday, and the urgency that our country demands at this time, and having been singled out that there's a vaccine for me, I am now inclined to consider taking it. Now, honorable member, I have one question. I saw on the news in the United States where they're indicating that, I don't know if this is the vaccine that you have to take 2 doses.
Yes, it is the vaccine that you have to take 2 doses. Even with the first dose, you are going to have a very large immune response. It's just that the second dose increases your immune response, I think, into the 70 percentile. And you take the second dose, the best time, it says, is in between the 8th and 12th week with AstraZeneca, but you can take it after the 12th week as well. So even if you didn't get your second dose, the first dose would still offer you immunity.
Thank you. And the follow-up to that is the reports indicated that after taking the second dose, you are able then to dispatch with wearing your mask, and you are also able to move about in groups.
I think, Mr. Speaker, you're still going to have to wear the mask. I guess the Prime Minister wanted to speak, so.
I still recognize the Honorable Member for Kalani.
Thank you, Prime Minister.
Mr. Speaker, that's an ongoing study. The CDC and others are still studying and looking at the way forward. But the recommendation is that once all individuals are vaccinated, for example, if all of us here in Parliament have been vaccinated, then we can behave normally. No mask, no social gathering, nothing. We're normal, provided all of us are. And that's the recommendation. So in terms of restaurants, once there's evidence that all have been vaccinated, then they need no mask. They can socialize. There's no social distancing. They can laugh. They can dance. They can do whatever.
Thank you, Honorable Member. Thank you, Honorable Member for Bamboo Town as well.
Thank you, sir.
As many? The chair recognizes the Honorable Member for Carmichael.
Thank you, Mr. Speaker. Speaker, I stand here once again on the shoulders of the people of Carmichael. And I thank them, sir, for the opportunity to be their voice in this place. Speaker, I was wearing this mask this morning. This was given to me by Emmanuel Missionary Baptist Church in Silver Gates. I just want to commend Pastor Evans and his congregation for their outstanding efforts that they are making as a church to protect their members And I'm grateful that they gave me a mask to wear. And I will wear this mask. Speaker, the people of Carmichael inspire me. They provide the wind beneath my wings and permit me to serve our nation. And I am so, so thankful for them. I spend much of my time in the Family Island, sir, seeking to improve the outdated infrastructure that we have, and also trying to make a tangible difference in every constituency in this country. Every constituency. For all of our people. And through it all, Speaker, my people in Carmichael are there with me. In fact, Mr. Speaker, as I speak now, I thank my Carmichael crew, some of whom were planning to be watching from the Carmichael Community Center on Amberger Street in the heart of Bel Air. So thank you, Ty, Dawn, Donna, Peter, Prudence, Quincy, Cameo, John, Bev, Chris, Raven, Bookie, Smitty, Ishmael, Marsha, Shanae, Bianca, Greg, Philip, all of the others whose names I can't call. I am forever indebted to you. Speaker, let me also congratulate a few special Carmichael residents. First, Mr. Speaker, Shante Butler, who celebrated her 18th birthday on Saturday. Congratulations again, Shante. You're relying on smart young people like you to make a step forward and continue to make a difference in your beloved Bahama land. I also wish to congratulate the elegant Mrs. Judy Roll, who also celebrated her birthday on Saturday and seems to get younger every year. Third, sir, Pastor Sabrina Pinder, who celebrates our pastoral anniversary this weekend, and her husband, Reverend Carrington, Dr. Carrington Pinder, with whom we celebrated the 196th anniversary of St. John's Mission Baptist Church on Sunday past. Speaker, I give thanks for all of their lives and the difference that each of them makes in the lives of so many of us. Speaker, I also pause to respectfully salute some of my colleagues. First, sir, Most Honorable Prime Minister. Speaker, we meet here today on a grim anniversary. 1 year ago today, sir, the World Health Organization declared an international pandemic. The Bahamas reacted quickly, and within days, the Prime Minister announced the first emergency order. Rosalind Carter, wife of former US President Jimmy Carter, is quoted as saying this, and I quote, "A great leader takes people where they don't necessarily want to go, but ought to be." Speaker, over the past year, none of us wanted to be locked down or to be subjected to curfews. None of us wanted to wear masks whenever we went outside. None of us wanted to be required to sanitize our hands whenever we entered a building. None of us wanted to stand on lines. None of us wanted to stop shaking hands or stop embracing our friends. Mr. Speaker, none of us wanted those uncomfortable PCR tests. But we did it because they were necessary steps to ensure that we and our children live through a time of great international uncertainty. Speaker, the graphic images of tens of thousands of people dying in Italy and Spain played on a nightly basis on our television sets, and they remain with me. It was a time of great fear and anxiety. Nobody knew what to expect as we faced an uncertain future without a cure in sight. Yet as a result of our response, we as a people are emerging stronger and more resilient. The undeniable evidence, Mr. Speaker, is that the prompt actions of Prime Minister Minnis saved thousands of lives. The exemplary leadership of the Prime Minister has guided us through these very challenging times, during which our country, and indeed the world, faced an unseen and unpredictable enemy. There was no playbook to tell us how to respond. Through it all, Mr. Speaker, the Prime Minister's leadership has been a consistent source of inspiration, even as the naysayers second guess with their undefined, unclear, unacceptable, and medically unsound claims. To his credit, the Prime Minister followed the medical advice. And even now, Mr. Speaker, he continues to warn us against complacency. And Mr. Speaker, we cannot afford to be complacent because this COVID enemy strikes relentlessly without warning. 1 year ago, Mr. Speaker, 1 year ago today, there were 118,000 COVID-19 cases diagnosed worldwide. Today, there are 118 million diagnosed COVID cases, and more than 2 million people have died from COVID-19. England is continuing their lockdown until at least the 21st of June, even though more than 22 million people in that country have already been vaccinated. The last 14 days, Jamaica has had almost 6,000 COVID cases diagnosed, an average of almost 400 a day. In Brazil, the entire health system is collapsing. Mr. Speaker, COVID is a world traveler, requiring no passports or visas to enter any country. COVID is a social butterfly that will attack the biggest crowds. As the Prime Minister continues to warn us, vigilance is our most effective weapon. We are profoundly grateful for his exemplary leadership, and as a result of his sincere commitment to the health of the Bahamian people, our country is now poised to vaccinate our people and return to pre-COVID normalcy. Speaker, the Prime Minister's visionary, courageous, and proactive response, together with his empathy, his compassion, mark him as a Bahamian patriot whose positive legacy will be recorded in history as that of a great leader. Prime Minister, I salute you for the thousands of Bahamian lives that you have saved. Secondly, sir, I offer my congratulations to the second fastest man in the cabinet, the new Minister of Youth, Sports and Culture. We need to have a race. We have to have a race. we have some Olympians here, Mr. Speaker, some fast Olympians. But right now, I recall he was the second fastest. The new Minister of Youth, Sports and Culture, the Honorable Hiram Lewis. And the people of Central Grand Bahama. I know that his Olympian efforts will make a tangible difference in the lives of our youth and our athletes. Third, Mr. Speaker, I congratulate the Honorable Pakeisha Parker Edgecombe, the new Minister of Disaster Preparedness, Management and Reconstruction, and the people of West End and Bimini. You are a true gem joining the cabinet, and you will touch many lives. Fourth, sir, I thank my friend, the big fisherman, the Honorable Benson Rule, for his faithful and dedicated service to the Bahamian people and the public service. You're retiring from public life on your own terms, and I know that you will enjoy the upcoming years fishing in Black Point Exemption. Finally, Mr. Speaker, sir, I pay tribute to the senior man, the member for Mangrove Key, South and Central Andros, a true patriot and a man who I respect and admire. And I note, sir, that during this debate, there's been profound silence from the other side in wishing him well. Mr. Speaker, I'm always proud to publicly state that he is my friend. He's been my friend for almost 40 years. He's been my friend in good times. He's been my friend in tough times. He's been my friend in public life. He's been my friend when others walked away. He's been my confidant. He's been our brother. He has been there in fair weather and in foul. Speaker, the fact that we are on different sides of the political spectrum was never cause for disrespect. And the fact that he has decided to leave with his dignity intact makes me admire him even more. Speaker, at the Mona, Jamaica campus of the University of the West Indies, you rose to the top as perhaps as the first and perhaps the only Bahamian to be president of the Guild of Students. I was proud of him then, and my respect for him continues to grow. You see, Mr. Speaker, in those days in Jamaica, we would sit for hours to discuss our goals and aspirations. My friend always spoke passionately about his love for Andros and his plans to give back. And Mr. Speaker, that he did. After 3 undefeated terms spanning 15 years, he's decided that he will not contest the 2022 general elections. As he leaves this place, he also leaves a legacy of achievement in his constituency. And while those in his party did not seek to elevate him to high office, Mangrove Key and South and Central Andros under his leadership can boast of more infrastructural capital development than the constituencies of all of his party's leaders and former leaders put together. Speaker, his party may not have looked out for South Andros, but the FNM did. So, Soka, I know Smith Hill is proud of you. Mr. Speaker, if it is the will of the people of Carmichael to return me to this place a year from now, I pledge to my friend that he will be an honored guest when the Lisbon Creek dredging and dock have been completed. That's his project. Nobody else can get credit. When the new Fresh Creek Bridge is built, he will be there to cut the ribbon. He will be respected as the visionary behind the South Andros Gym. And Minister, when the Bahamas Games basketball kicks off in his gym, he will be a participant in the opening ceremony. Speaker, I have not forgotten his fervent desire that his pet project in South Andros will bear his name. And no doubt, Mr. Speaker, no doubt, he will be on the air broadcasting when Felicia Knowles is sworn in as the MP for Cat Island, Salvador and Rumkey. He will be on the air broadcasting when Jennifer he will be on the air broadcasting when Jennifer Isaacs Dotson is sworn as the MP for Exuma and Ragged Island. And Mr. Speaker, he will be on the air broadcasting when his fellow Androsian, young Kenneth Smith, is sworn in as the MP for Mangrove Key, Central and South Andros. So, Mr. Speaker, in another year or so, the senior man will leave this place on his own terms and of his own volition. He will leave with his head high, his dignity intact, and with a long list of accomplishments. He will leave, but I know that he will still be my friend, a fellow Androsian who cares deeply about his home. Soka, I know that Smith Hill is proud of you. Mr. Speaker, as Ronnie Butler used to say, I know him a long time. Speaker, I turn now to Carmichael. From one of my favorite people to one of my favorite places. I thank the residents of Carmichael for their continued support and confidence. And I take the opportunity now to update them on a few developments. Speaker, we value our educators, and we do all to ensure that they are safe. So these are the masks that we have provided to every educator at the Anatole Rogers High School. Every educator. It says exceptional educator at Anatole Rogers. And every teacher and administrator at the school has that. We want to ensure that our students are safe. And so these are the Anatole masks for students. Every student at Anatole is able to get a mask that we were able to donate to that school. Every single student. Speaker, at the Gerald Cash Primary School, every teacher, every educator has gotten a mask from us that says exceptional educator at Gerald Cash. Everyone. So that they can stay safe when they return to school. And Mr. Speaker, we've gotten masks for every student at Gerald Cash. We think we did over 900 of these masks. And they were done in different sizes depending on the grades. This is a grade 4 mask, but every student at Gerald Cash is going to have a mask. Make sure to match their uniform to ensure that they're safe when they're school. We've not left out our preschool children at Gerald Cash and Andy Gar. And so they all got face masks. We have face masks for our preschool children. We're going to ensure, Mr. Speaker, that as our children return to school in the Carmichael constituency, that they have face masks, they have hand sanitizers, and they are protected as they learn. We accept, sir, that we are brothers keepers. We want to keep our teachers and our students safe. Speaker, I thank the residents of Carmichael for their maturity and their patience during the pandemic. And I ask for their continued understanding as we prepare to vaccinate every willing resident of this country. And I look forward to the days when COVID will only be an unpleasant memory. The past few months, sir, I'm thankful, and I heard some comments about sidewalks yesterday, I am thankful that we've been able to build sidewalks in critical areas of the Carmichael community, as well as other areas throughout this island. So, Mr. Speaker, while the politically biased critics drive their luxury cars, those sidewalks, especially on Faith Avenue, have kept our students safe as they walk to the Anatole Rogers High School.
Thank you very much.
And they have provided income for many, many families.
Talk to me. Talk to me.
Yes, Mr. Speaker, I am proud of those new sidewalks. And in the next budget, I will speak about them. Speaker, in 2018, we answered the long-standing pleas of residents of Silvergate. We answered the pleas of the residents of Silvergate. Thank you, sir. Thank you. We built the best park in the country in Silver Gates. But Mr. Speaker, my friend from Bain and Grantstown, Speaker, the Prime Minister conspired with my friend from Bain and Grantstown, and they decided to turn the Southern Recreation Ground into the country's preeminent park for the people of Grantstown, Bain and Grantstown. And I'm really pleased that my ministry was able to lead that charge, Prime Minister. So, Mr. Speaker, Carmichael has risen quietly to the challenge. We know that the medical advice is that when we are outdoors, fresh air is constantly moving. And this process disperses respiratory droplets, making it less likely that we will breathe in sufficient of the droplets to contain the virus that caused COVID if we are outside. The Mayo Clinic's website points out that outdoor activities, such as exercising in community parks, helps us to feel less tense, less stressed, less angry or depressed. The website also points out that sunlight infused our body with vitamin D, thereby improving the strength of our bones and overall health. So in Carmichael, Mr. Speaker, we have been investing in healthy activities in our community. This first photograph, there are 8 parks in Carmichael, sir, that we have installed exercise equipment in as a first step in their overall development out of our constituency grant. This is the first park, a photograph of a little park on the corner of Faith Avenue. It's just a little corner park next to the gas station. It has a walking trail. It has a children's play area. It has play equipment. And we're putting a barbecue pit right here. This is just a tiny little corner park right on Faith Avenue and Carmichael Road. This is the kind of thing that we are doing in our community to keep our people safe. Speaker, this is the Bel Air Park in Carmichael that we hope will be named after Phil Smith, who was a long-time resident of Bel Air. And we've just started this park. We've started renovating this park now. And so, Mr. Speaker, you'll see that the walls are up to protect the community. We've started in the children's play area, 2 play areas for children. We're going to resurface these basketball courts. We're going to ensure that the Bel Air Park is an outstanding park. We're going to put a pavilion here. It is going to be an exceptional play area, an exceptional family area in Bel Air, in the heart of Carmichael. Speaker, this one is my prize. This one is my real prize. Speaker, this is the Mermaid Park next to the Mermaid Hole in Golden Gates number 2. It has the longest walking track anywhere in this country, Mr. Speaker. This walking track has 3 portions to it, 3 areas. If you walk, the whole walking track is over a mile. Walk around. We're refurbishing the basketball court, so this is going to be fixed here. We're building a new tennis court here. We're putting a parking area here, a children's play area, a pavilion, a soccer field, and then there are going to be children's play areas here. This is community development. This is what we are doing in Carmichael. This is what we are stimulating, how we are stimulating our economy. So, Mr. Speaker, we are following the medical advice to ensure that Carmichael residents now have the best option to exercise safely in fresh air. Next up will be the parks in Flamingo Gardens, Emerald Gardens, and Garren Owen Park. You see, Mr. Speaker, we will never rest in our mission to continue to keep our Carmichael safe. In this vein, Mr. Speaker, I want to assure residents of Nigeria Drive and polling division number 14 that there is no such place known as death row in Carmichael. And any politician who repeats such nonsense is disrespecting you and has no idea what he's talking about. Speaker, I want to move on to questions and answers. The opposition has asked me 2 questions, and I'm glad to see the member for Exuma here because he's the one who asked them. And I'm going to answer them. The first question is, will the Minister of Works please advise the House whether solar energy construction on Ragged Island is complete and delivering electricity to the people of Ragged Island? The Speaker, in order to answer this question, I must first put the entire challenge that we faced in Ragged Island in context. Because as a result of that challenge, BPL has embarked on the most ambitious solar energy initiative that the Bahamas has ever seen. I have a document that I will read from, which I will table on completion so that everybody can see it. It's important first, sir, to remember how we got here. Hurricane Irma was a Category 5 hurricane that hit Ragged Island on September 8, 2017. It caused widespread devastation on the island. Prime Minister, in his vision, announced that Ragged Island will be rebuilt as a green island. And that involved the introduction of renewable energy, sustainable water production, and purification. In mid-2018, BPL was brought into the picture to take the lead in establishing a high energy penetration renewable solution on the island. Rocky Mountain Institute was engaged to work with BPL to develop the project. In October 2018, the de-risking process began in order to gather information on the planned location to feed into the tendering process. Also, a request for qualifications was posted so that companies interested in participating in the main tender could pre-qualify to make the short list. After the pre-qualification process, 14 identified companies that met the requirements to move on were selected in April 2019 to respond with proposals for the project based on the details included in the issued tender. In June 2019, a contract was signed with Tulia Energy, the EPC contractor for the execution of the Ragged Island Solar Microgrid project. At the start of the project, we held a community meeting to update the local Ragged Island community on the project and our schedule for implementation. And all of our partners were involved in the process. Speaker, we are constructing an integrated solar, battery, and energy storage and conventional generation microgrid. The goals that we have in mind, first, a hurricane wind rating of 180 miles per hour. Secondly, the ability to meet 95%, more than 95% of the pre-Irma energy demand on Ragged Island. Third, the ability to be expanded in the future. And fourth, to reduce conventional generation to less than 5%. We believe that we will meet these goals. Speaker, there are 924 and 435 watt sun power solar panels with a peak output of 401 kilowatts. Irma had a devastating impact on the installation, BPL's installation in Ragged Island, with, in addition to the pole and line damage to generation and the generation site. So a major part of the project is to upgrade this site and address issues caused by Irma. The site today has been remediated, has been redesigned with current operational safety standards in mind. New hurricane-resistant structures have been constructed, and the SMA best container controls and MV gear has been put in place along with new BPL, medium, and low voltage switchgear. The batteries have now been installed in the climate controlled BESS unit. During the day, and I will tell you how this will work. During the day, the solar array will produce power to the grid, and that will be used by the community. The excess energy will be stored in the BESS unit, and the diesel generators would be off. At night, the BESS unit will release the stored energy into the grid to be used by the community. If the energy in the BESS unit starts to run low, it will send a signal to the generator controllers to start a generator to make up the shortfall in capacity. At current load levels on Ragged Island, it is anticipated that the generators would not have to run at all unless there are successive days of inclement weather. As mentioned earlier, at pre-Irma energy demand levels, the system is designed to meet more than 95% of the needs of the island. Speaker, the project was scheduled to complete testing. The project was scheduled to complete testing and commissioning by the end of December 2020. However, a technical issue identified during the commissioning has caused a delay. All the elements of the project have been installed at the sites, and the EPC contractor, solution provider, independent engineers, and BPL have identified 2 solutions to address the issue. Currently, the EPC contractor is getting quotes and timelines for the required equipment for each of these solutions. It is anticipated that this may require approximately 12 weeks to acquire and implement once identified. The integrated generator control, solar panels, inverters, and battery storage have all gone through preliminary testing. Currently, the island is being supplied via conventional generation, and this will be transformed to the microgrid solution once the required components are installed and the system commissioning completed. So, Mr. Speaker, the short answer to the question is that we expect the technical glitch will be resolved by the end of May, and beginning in June, 95% of the power in Ragged Island will be generated from the largest, most modern solar field in the Bahamas. Speaker, second question. Will the Minister of Works please advise this House on the timeline for the completion of the school on Ragged Island? Speaker, the construction of the school in Ragged Island is perhaps the most challenging construction project that the government has ever undertaken in the Bahamas. It was mandated when Hurricane Irma decimated Ragged Island, which had a very old schoolhouse and a dilapidated teacher's residence. At the time, very few buildings on Ragged Island met the building code. Many of them, like the airport, had foundations that were just sitting in the sand. The contractor has employed more than 70 men. The contractor has employed more than 70 men. To work on the project. And has hired every resident of Ragged Island who applied to work with him. Not one has been turned down. In order to commence work, he first had to build a man camp so that the workers can live in sanitary conditions as they work every day. Every week, he has to send a barge with supplies to Ragged Island. He's continually transporting workers between Ragged Island and New Providence by charter aircraft. And prior to every trip, they are all tested for COVID. Speaker, I can announce that not a single worker on that project has tested positive for COVID-19. It is a monumental task to manage the project, sir, and we are fortunate to have one of the most organized contractors in the country supervising the project. Speaker, currently our building code specifies that buildings are to be able to withstand winds of 150 miles per hour. The school in Ragged Island is being built to withstand winds of 180 miles per hour. It will be a model for all schools that we build in the Family Islands in the future. In addition to the classrooms themselves, the school will have modern, comfortable residential accommodations for teachers who are stationed in Ragged Island and will serve as a hurricane shelter that can accommodate the entire population of Ragged Island should another hurricane hit the island. Speaker, this is the current state of construction of the school in Ragged Island. This is what it looks like now. That's where we are now. It's going to be a hurricane shelter for the whole community, school for the children, residences for teachers. This is what the front, and Mr. Speaker, this is what we can be doing in the Family Islands with schools. So when we get around to Cat Island, when Ms. Knowles is in Cat Island, if we get around to getting a school in Cat Island, we can do a school like this in Cat Island. Mr. Speaker, this is what the school is going to look like at the front. And you see that it's elevated at this point because there are floodplains there. And so if there are challenges with hurricanes, we're going to have water under the structure. That's how we should be building a whole lot more in the Bahamas. So that's what Ragged Island School is going to look like at the front. This is another view of what the school is going to look like, Mr. Speaker. I might want to transfer my grandchildren to study in Ragged Island. This is what it's going to look like. It is going to be the ideal for what we're going to have in Family Islands. It's going to be good to have Ms. Dotson open that, you know. Let me show you what it's going to look like on the inside in the courtyard. That's what the courtyards are going to look like. That's what the people in Ragged Island are getting. That's how much we love them. Mr. Speaker, this is what Ragged Island is getting. Let me give you one final view, Mr. Speaker. The teachers' residences, where they're going to be. Mr. Speaker. Wow. Speaker, this is Ragged Island. This is what the vision of the Prime Minister was for Ragged Island.
We only laugh at one thing now. We suppose.
If it's open after election, it'll be Jennifer Isaacs Dotson opening it. Speaker, I want to turn to speak about the Family Island development. And today, Speaker, we anticipate that the school will be ready for occupation in January 2022. And when we open the school, we intend to invite all descendants of Ragged Island to return home so they can see the amazing school for themselves. I am going to focus most of my time today on infrastructure development in the Family Islands. For many years, Mr. Speaker, residents of Family Islands have been treated like second-class citizens. In those communities, docks and bridges are just as important as for their livelihood of residents as vehicles in New Providence. Speaker, I'm an island boy. I grew up fishing on the rocks, catching crabs, sculling boats, and climbing coconut trees. I know how challenging it is when your dock is destroyed or when you have no seawalls to protect you from surges. I know what it's like to attend a one-room school and have to sit outside under the trees for some of your classes. So, Mr. Speaker, with the guidance of my Prime Minister, my cabinet colleagues and I have set out to provide modern amenities throughout the family of islands. And despite the challenges brought on by the worldwide pandemic and the recession that have impacted every country in the world, we have no intention of stopping. We are stimulating family island development economies with sustainable projects that will make a tangible difference in the lives of Bahamians and that will improve our tourism product for decades to come. So, Mr. Speaker, I am going to just go through the calendar of what we have done in recent months during this midterm. On November 27, Mr. Speaker, we were in Baritari, Exuma. You know, Mr. Speaker, Exuma was represented by PLP MPs for 15 consecutive years, plus the last four. And the question, Mr. Speaker, is what did they do? And that's a very easy question to answer. So we've opened the docks in Baritari. Baritari is the gateway to the Keys. Baritari is from when you get to Baritari, you go into the most beautiful area of those keys in the Exuma Keys. We've put in 4 ramps and 2 new docks. And our tourists, I saw some pictures. Mr. Speaker, first time when tourists started coming back to the Bahamas, I saw some pictures of the Baritari dock. And you'd believe that that was almost downtown Nassau with the number of people who were on that dock. So we spent $561,000 to build that, and that is going to pay back this country. Mr. Speaker, we are paving the roads in Exuma. The government of this country is going to ensure that Exuma has asphalt roads for the first time. No more second-class status to Exuma. You get asphalt roads. And the government has put aside $8 million to do that. The scarifying of the roads have started, Mr. Speaker. And Mr. Speaker, the roads in Exuma are in such bad condition that the scarifying process has to actually go straight down past the base. It is terrible. It is in terrible condition. And so Exuma is going to get new asphalt roads. Plant has been set up and the process has started. And for the first time, people in Exuma are going to be able to ride on the same roads that all of y'all in New Providence get. No sand seal. Speaker, the member for Freetown spoke earlier in this debate about the new international airport. You see, Mr. Speaker, we're not just talking about what we're doing. Exuma is going to have a first-class international airport that this FNM government is building for it. Speaker, on the 18th of December, I had the honor to visit Long Island with its outstanding young member of parliament, Mr. Adrian Gibson. We were able to open the Newton Ski Bridge in Long Island. Speaker, this bridge is the first bridge that's been built in the Bahamas since 1988. This bridge was built by a Bahamian who is from Long Island. This bridge gives Long Islanders access to one of the most beautiful areas, touristic and scenic areas that you could imagine. And the member for Long Island was speaking about how people are already using it to take wedding pictures and for other purposes. This is a beautiful, iconic bridge. And when we came to Long Island to look, old bridge had fallen in and had been there for 2 decades, just sitting there. The tide wasn't able to run properly. And this water flow around Long Island is very critical to the ecosystem. It's very critical to the ecosystem of Long Island. So we have a beautiful, iconic bridge going over to Newton's Key. Congratulations, Long Island. The cost of that bridge, Mr. Speaker, was $548,000. And as I indicated, it was built by a young Bahamian. Speaker, we also had the opportunity, that occasion, to officially open the Monument Road. And the Monument Road was built under this Free National Movement government so that Bahamians and visitors to our country could have access to the Columbus Monument. And when you get to the top of that monument, Mr. Speaker, it is one of the most beautiful sights you can ever see in your life. So, Mr. Speaker, the Monument Road, you used to have to walk up a slippery slope with pebbles under your feet. What we did was pave the road, cleared it, paved the road, and also built steps into the hill. And so this is a view from the top of the hill coming down the steps. So you're coming down to the Monument Road, and you take these steps and you can get all the way up to the top of the monument. This was done, this work, Mr. Speaker, was also done by a Long Island contractor. This is outstanding. It is an exceptional job that they did. You can take your time, go up those steps. I have the tree upside down. You go up those steps and you get to see the wonderful views from the monument in Long Island. Speaker, we didn't stop there with Long Island. Long Island also, Mr. Speaker. You see, Long Island, when members opposite are in power, Long Island doesn't get anything. Just as with Exuma, the government has allocated $5 million for the paving of roads in Long Island. And just as with Exuma, we're not going with sand seal roads. We're going with asphalt roads. The plan has been in Long Island. I understand the road is being scarified, and I'm looking forward to being able to go to Long Island and drive on those roads. And Mr. Speaker, if that is not enough, in addition to the waterworks that the member for Long Island spoke about, Long Island also is getting a new international airport. Speaker, one of the most depressing times I had, Mr. Speaker, was going to the birthplace of my grandfather. My grandfather was born in T-Bay, Cat Island. And from the time we flew into that airport, I was really, really, really concerned. Yes. People of Cat Island need lots of help. After 20. So, Mr. Speaker, Speaker, under the leadership of the Executive Chairman of Water and Sewage Corporation, we signed a contract for a little over $3 million so that the people of Cat Island could start getting water, affordable water in their homes. Something very simple that we take for granted every day. I want to commend Long Island for what he's done to ensure that my people in Cat Island can get water. I promise, Mr. Speaker, that I will return to Cat Island because the roads are in deplorable condition.
No, sir.
The airport needs repairs, Speaker. And I am going to do something in Cat Island to make a difference, Mr. Speaker. So you all could count on me to do some things to make a difference in Cat Island. Mr. Speaker, on the 8th of January this year, speak on the 8th of January this year, I had the honor of seeing another iconic bridge open in Spanish Wells under the leadership of the Member of Parliament for North Eleuthera. Speaker, what you're going to see with the bridges that we built, and from, as I indicated, the last bridge before we built the Long Island Bridge, the Newton Ski Bridge, was built over 30 years ago, in 1988. But now we've built a bridge in Long Island, and every built bridge we build will be different. Every bridge we build will have a different character. Every bridge we build will be equally iconic and equally beautiful. And so, Mr. Speaker, this is the bridge that was built by Bahamians in Spanish Wells to connect Spanish Wells with Russell Island. It looks like you are in the middle of New York or something. It's a really iconic bridge. Mr. Speaker, I thank the member for North Eleuthera for cooperating and working with us and ensuring that his people have an outstanding and beautiful bridge. Mr. Speaker, our commitment to Eleuthera goes deeper. We have committed some $11 million to paving the highways in Eleuthera. I didn't bring the photographs. I have photographs where the asphalt is going down. And that highway, I remember, Mr. Speaker, for years, the people who did the Ride for Hope used to come to me every year and ask us to just fill in the potholes in that road because it was in such, it was in such terrible shape. And so $11 million has been committed. The asphalt plant is there. The work has started. And Eleuthera has started to get asphalt roads for the first time in its history. Speaker. But, Mr. Speaker, there's more. Speaker, the member for North Eleuthera took me to Harbor Island, his home. And he said, look at our roads. My people in Harbor Island need better roads. And so, Mr. Speaker, because of his commitment, the government committed $2.6 million to pave every single road in Harbor Island. Mr. Speaker, that is how you take care of your people. And that's a stark contrast to what I saw elsewhere. Speaker, the member for South Eleuthera was equally convincing. Even more so, He drove me through those terrible roads in every one of those settlements in Eleuthera. He drove me through every settlement road. And he ensured that we committed to doing something with those roads. And so, Mr. Speaker, because we are near the end of the budget, we had to start with one settlement. We've decided to start with Tappan Bay. The government has committed $800,000 to ensure that the roads in Tappan Bay are paved. And when Tappan Bay is finished, we are going to start with the other settlements that he's shown me. Speaker, as with, we couldn't give Exuma and Long Island airports without a new airport in North Eleuthera. So, Mr. Speaker, the minister, the member for Freetown has already spoken about this. But North Eleuthera is also going to get an iconic, a beautiful, iconic new airport, and the money is in the budget. The Speaker, the project that I'm most fascinated with is going to happen in Eleuthera. And it is going to be the most iconic project that we've ever done in this country. Right now, you go to Eleuthera, you have challenges crossing that glass window bridge. You have to stop. You have to know when to go. You have boulders the size of cars being thrown up in the air, 30 feet up in the air. If you have a car on it, the car can be washed off. It is the most beautiful place that you could ever see when the weather's calm, because on one side of it is the roughest waters of the ocean that you would ever see. And then you walk across on the other side, just 20 feet, and you see the calm waters that you could just walk in and swim and walk in. It is a wonder of the world. And so, Mr. Speaker, we have had engineers doing engineering studies for some time now, and they are almost complete with those studies. We have renditions of what the new glass window bridge will look like. So, Mr. Speaker, before the end of this year, we're going to put the new glass window bridge out to tender. And before the end of this year, we want to start construction. So, Mr. Speaker, I want to just give you an idea of what these are going to look like. This is a preliminary sketch of what we're looking to do. You can see what the ocean is like on one side, and you can see how calm the water is on the other side. So I'm going to give you several versions till you see what the bridge is really going to look like. This is where we're going with the glass window bridge. It is going to be a highway above the ocean. It's going to be exceptional. Mr. Speaker, this is another view. And what you see, this bridge is also going to have a tourist village. It's going to have a place where Eleutherans can work, where the visitors can stop and get iconic views of the ocean and spend some money in Eleuthera. This is what it really looks like. This will be the tourist village here. This is what it really looks like. That looks like you were somewhere in San Francisco or going across some major bridge. The Bahamas is going to match all of those developed countries with what we do. This is going to be the tourist village here. And you're going to have opportunities there. And Mr. Speaker, the Bridge Authority is going to be able to issue bonds to build this bridge And we're going to bring the legislation here with respect to the bridge authority very, very soon. So Elutra, before the end of this year, we want to start building that bridge. But Mr. Speaker, before we get to the end of the year, I just want to remind everybody that in Roxtown, in Saudi Lutra, we have an outstanding, exceptional dock being built for that community. 2 docks. $2,834,000 going into the Roxtown dock. So the people of Elutra can be very, very proud. And I believe that on the 9th of April, the Prime Minister's schedule and my schedule agree to that. That's when we can be down there to open that dock with the Member of Parliament for Saudi Lutra.
Make sure we carry golden eyes. Golden eyes from the Lutra. Let's make sure we carry golden eyes. You carry golden eyes too? Yeah, golden eyes.
Speaker. Speaker, on the 5th and 6th of February, we were in Abaco. Speaker, we were in Abaco for the official opening of the Dawn Road in Abaco, in Albuquerque. And the challenge with the Dawn Road is that for almost 20 years, hurricane winds had caused that road to deteriorate. The beach was gone, the sand was gone, the road, entire coastline had eroded into the road. Only half of the road was there, the other half was gone. If we had allowed it to continue, Albuquerque would have probably been cut in half. It would have been cut into 2 different separate keys. And so your proactive government, as the Speaker, issued a contract after tendering for $2.9 million to restore the Dawn Road. And now if you go in Albuquerque, the beach has come back, the whole Dawn has been restored, and there is no threat of Albuquerque being cut in half, Mr. Speaker. Speaker, we also had the opportunity to look at some of the challenges that the city of Marsh Harbor had. And one of the challenges that they had in Dorian was the fact that their seawall protections were not sufficient to protect the city. And so your government, sir, has issued a contract to Bahamian contractors from Abaco to build seawalls along a portion of that coastline right outside Marsh Harbor. Contract for $1.14 million to protect residents of the Dunderstown community, Speaker. That seawall is progressing quite well. Additionally, Mr. Speaker, the heart of Dorian, a bridge that was built to connect Little Abaco and Great Abaco went missing. It was a bridge that was ill-advisedly built. It was really a causeway, and it could not sustain the hurricane winds. It was built under the former administration. It was not something that would have been advised by the engineers. And so that bridge fell into the water. Your government, Mr. Speaker, has issued a contract to outstanding Bahamian engineers to build a real bridge to connect Little Abaco and Great Abaco. Contract is for $5.3 million. And when you see that bridge, Mr. Speaker, it is going to be just as iconic as the other bridges that you've seen. It is going to be an exceptional bridge, and the people of Abaco can be very proud of it. Prime Minister, I hope that on April 23rd, you will have the time so we can go down to Abaco and open that new bridge. My most unpleasant duty in Abaco, Mr. Speaker, was to go and look at this illegal housing community. Speaker, there are legal maneuvers in the court, and there are several injunctions in place. And one of those injunctions says that nobody is to build any illegal housing anywhere in the Bahamas, and any unregulated housing. Mr. Speaker, let's understand the importance of this. When I go in these unregulated communities, I see open septic tanks. Open. They're health hazards. You see wires running haphazardly. You see generators around in the communities that frighten you because you know what could happen. You know people can be electrocuted. You know there can be fires. At the time when we visited, there was a dead body, a man who had been killed by the vapors from his generator. Speaker, I am honored to say that Cabinet has now given me a mandate in respect to that illegal housing community at the farm in Abaco. Speaker, before the end of this month, we're going to see action started. And that action is going to be relentless, Mr. Speaker, to ensure, first of all, that property, Bahamians, protected, a birthright. Secondly, that when we build communities, we have safe communities. That our water table is protected, Mr. Speaker, because you don't know what is happening to the water table. The Minister of Agriculture has done studies, and he's been very, very concerned. And what I've seen, Mr. Speaker, concerns me about where we're going. So I want to give notice, Mr. Speaker, now today, that there is going to be action. There is going to be decisive action in relation to that unregulated community. And my ministry is going to continue to work to ensure that where people see fit to come and build unregulated communities, quick action is going to be taken. An effective action, Mr. Speaker. And so I'm not going to say anything else now, Mr. Speaker, but you're going to see the action that's going to be taken. Speaker, is this convenient time or should I go on?
Mr. Speaker, I again think that this would have been one of those good days to extend the business of the House beyond the 1 o'clock hour in light of the good news, the abundance of good news that we're receiving. But since the good member for Carmichael was generous enough to yield, I now move that the business of the House suspends for the luncheon break and return at 3 p.m. today's date, Thursday, the 11th of March, 2021.
Thank you, honorable members. Honorable members, just before I put the motion, I just want to say this because I believe this is a great day in the history of our parliamentary democracy. I want to first of all thank the member for Bamboo Town during his contribution, and I want to thank the member for Kalani, and most especially I want to thank the member for Carmichael. One of the major functions of the Parliament is its oversight function. And today, the member for Bamboo Town, the member for Kalani, and the member for Carmichael assisted this Parliament like it has never been assisted for the past 2 sessions of this Parliament by answering questions initially put from the chair, and secondly, questions that were on the agenda by the member for Exuma. I believe this is very significant because this is coming as we approach the Ides of March, which is 74 days in the Roman calendar, and it is normally celebrated on the 15th of March. It is marked by several religious observances, and it was notable in Romans' time for the deadline for settling debt. And today, in particular, I would say that the member for Carmichael has earned his QC. In that he initially recognized the obligation of the government side to answer questions, and indeed manifested that recognition today by answering question 33 and 34 on our agenda. Mr. Clark, I would like for you to note that those 2 questions were answered today, and contrary to public belief, there are 36 lead questions on the agenda with 37 supplementary questions to those lead questions, making up a total of 73 questions. And interestingly, the question by the chair today made 74, the very number of days before the Ides of March. And I think that is very significant. That is one of the main purposes that I had hoped to achieve as an independent speaker, to increase the oversight function of the Parliament. I'm ready to leave if I'm able to achieve the second one as Speaker. The second objective that I hope to achieve before this session is complete is the independence itself of the Parliament, the autonomy of the Parliament. The day that bill passes and the Governor General puts his signature, giving it the royal assent, that could be my last day in this Parliament. I would feel that I have made a contribution to the parliamentary democracy of the Commonwealth of the Bahamas. And so, my simple admonition and request going forward is that we seriously consider the Parliamentary Services Bill. I believe that would elevate us to the other mature jurisdictions with respect to the deepening of parliamentary democracy in our country. And I want to commend the members on the government side, especially the member for Carmichael, the member for Kalani and the member for Bamboo Town for the initiative today, which moves this parliament and our democracy to a new level in the Commonwealth Parliamentary Association. Honorable members, it has been moved and seconded that the business of this House do suspend until the 3 p.m. hour. As many members who are in favor will remain seated, those who oppose will stand. The business of this House stands suspended until the 3 p.m. hour this afternoon.
All right.